It's my pleasure to introduce Rachael, Maima, and Linda Deys. So Rachael is a registered midwife with over a decade of clinical experience in maternal and child health across major hospitals in Papua New Guinea. Rachael holds an executive MBA from Fiji National University, reflecting her commitment to clinical excellence and leadership in healthcare. Linda Deys is an endorsed midwife, registered nurse, and international board certified lactation consultant with over 35 years clinical experience. And she's currently working in a clinical midwife consultant role on the south coast of Australia. Rachael was a PNG Midwifery Buddy in a collaborative project with Linda over the past year. Their work focused on improving antenatal care, including securing HemaQ devices for the antenatal clinic through support from the Australian Defence Force, Port Moresby. So it's with my great pleasure that I'll hand over to Rachael and Linda for their presentation. I'll be monitoring the chat throughout, so if you have any questions for our speakers today, please either pop them in the chat or save them to the end and raise your hand as already mentioned. So I'll hand over to you both now.
Thanks, Sally. Are you seeing the slides, Rachael? Are you ready to go?
Yes. Thank you, Ali, for this great opportunity given to Linda and I to share our PNG Buddy Program experience on this platform. Basically, this Buddy Program was all about empowering midwives to build the confidence and leadership skills, enabling us to advocate and effectively driving positive changes within the communities that we serve. So this Buddy Program actually was all about improving maternal and newborn outcomes in Papua New Guinea. Buddy Program was financially supported by Rotary Club of Morialta, Port Moresby, and International. Professionally, it was supported by the Australian College of Midwives and the Papua New Guinea Midwifery Society. It's a twinning project between Australian and Papua New Guinea midwives through leadership, advocacy, and mentoring. The first workshop was introduced in 2019, 4 completed, and the 5th and final one commenced in April 2025, and which is expected to be completed in April 2026 next year. This is the map of Papua New Guinea. Papua New Guinea is north of Australia, and I am in Port Moresby, and my another buddy is in Bougainville. It's a province 2 to 3 hours flight out of Port Moresby. And this is the maternal and newborn mortality rates in Papua New Guinea are among the highest in the world. Around 170 deaths for every 100,000 women and 20 neonatal deaths per 1,000 live deaths each year. Many of these deaths are preventable and treatable when women have access to safe, quality health care and midwives. The conception of Group 4 buddies in 2024, the photo on my left top are 14 PNG midwives, these incredible midwives. They flew in from different provinces within the country, and some they work in very remote part of Papua New Guinea, and they all live in different provinces. We have about 21 to 22 provinces within the country, and they flew into Port Moresby City to participate in this program. And the photo at the bottom are the Australian midwives, 7 of them. And this program was hosted in Port Moresby under the leadership of Judith Brown, Mary Sitine, who is the president for the Papua New Guinea Midwifery Society, and Paula Jebedi, and Dr. Julie Kerr. Professor Helen Hall also supported us, but from Australia. She was unable to attend in person. We learned a lot about each other, about leadership, about PNG and Australia. So each of the Aussie buddies were paired with 2 PNG buddies. We identified projects and work commenced at the workshop, and all our projects were aimed at reducing maternal and infant morbidity and mortality in Papua New Guinea. Each of these projects were identified from where we were. We identified the needs at our workplaces and brought them to the table, discussed with our Aussie buddies, and we strategized how we could bring solution to each of those problems. And we took small steps, and each project was expected to finish within 12 months. So these are my 2 buddies, PNG and Aussie buddy. So Elizabeth Mondry, she is a family health services coordinator from Bougainville, the island that I just shown on the map a while ago. Bougainville District Hospital, that is where she works. Her project was about baby bundle incentives. Due to the high maternal mortality we have in Papua New Guinea, her project aimed at having more women coming to have supervised births by a midwife. For me, I am the sister in charge at Maringa's military clinic within Port Moresby. I identified that there were about 100% of women who had unknown hemoglobin level, and I aim to improve that maternal and newborn neonatal outcomes by knowing and treating low hemoglobin. And the project identified was to secure a HemoQ device. And Linda Deys is a clinical midwife consultant from Australia, New South Wales. She was very instrumental in guiding, mentoring Elizabeth and I with our project. The HemoQ project proposal was written with a lot of guidance from Linda, with the title Improving Outcomes for Antenatal Women Receiving Care through the Maringa's Military Clinic in Port Moresby, Papua New Guinea. With the problem identified, less than 10% of women receiving antenatal care through the clinic had a low hemoglobin due to many factors, and one of them is unreliable pathology results, and also the facility that I work in lack a diagnostic equipment, and there are many other factors as well. And anemia is common. Malaria, HIV, and also diet are other contributing factors to anemia, but it is also treatable and preventable. Evidence supports that anemia in pregnancy increases the risk of preterm death, low birth weight babies, ongoing infant anemia, impacting development, postpartum hemorrhage, preeclampsia, and is associated with maternal depression. So our project goals aim to have a low hemoglobin for all the women that were coming for the antenatal clinic at the facility where I am working. And we also aim to appropriately treat all the women with anemia in pregnancy to improve labor, birth, and postpartum outcomes for mothers and babies. So the project identified was to secure HEMA-Q, and this is a quality improvement project. The problem that we identified, 100% of women without hemoglobin results. So these are the process that we took. Point of care testing would mean that the results were available immediately and were not reliant on undependable other services, and meant that the treatment could start at the time of appointment. The HEMA-Q device was suited to this purpose. Data was collected through the antenatal register and literature review done and compiling a project proposal, and the proposal was submitted for source funding to 5 different sources. Quotes were also obtained from Maiden, a healthcare supply in Port Moresby, and attached to the proposal. I did a follow-up fortnightly in the midst of busy schedule of patient care for 9 months. And 4 funding sources turned down my proposal and 1 accepted, and that was the Australian Defence Force in Port Moresby. And I received a HEMA-Q in January 2025. And that's the HEMA-Q. It was a success for me. And this is my boss. She's the Director Nursing Services for the Department of Defense Health Services in Port Moresby. She's delivering the HEMA-Q and the microcuvettes to me. And the sustainability part of it was planned under the PNG Defense Force clinic budget to continue to maintain costs and other device maintenance. So this device is now used at the clinic. It's very beneficial to all the women and their family within the community that we are serving. No more waiting for 2 to 3 weeks to receive their results. They're receiving their results within 5 to 10 minutes. Staff education was also done. The nurses and midwives whom I am working with, I trained them on how to use the HEMA-Q device, on the proper use and maintenance of the device, interpretation of the hemoglobin results, as well as the clinical decision making based on the test outcomes. So in also this, I have also showed them that those women with hemoglobin less than 10 grams per deciliter, we are supplying them with micronutrient supplements, and those with hemoglobin less than 10, we supply them with iron tablets, and those with hemoglobin 7 and below, we're referring them to the hospital for further management. So the next steps, data collection will continue to show the number of women who now have a low hemoglobin. An ongoing research is planned to review the outcomes of anemia, which is managed labor, birth, and postpartum, as well as the patient experience. The PNG Buddy Project 2024 has ended. However, it is hoped to repeat this process over in other clinics. So I have also applied to Australian Alumni Grant Scheme, and they have approved my proposal for another HEMA-Q, which is also successful, and I will be receiving the HEMA-Q soon, and that HEMA-Q will be placed in another military clinic within Port Moresby, especially clinics that are running antenatal clinic. And Linda and I intend to continue our relationship, our friendship, and use the skills we have obtained to support other future midwifery leaders. Some of the challenges experienced along the way. Though I submitted 5 proposals, 4 got rejected, and I also received setbacks from the bosses, the authorities not recognizing small initiatives like Hemocure project, and lack of logistics. I also have to dig into my own pocket to fund the transportation, printing, and binding documents. I also have 3 kids, all below 10, and they needed my attention. Not only that, I have to support my husband with necessities of life to complete his PhD, which he graduated recently in April. Things which I have learned, this buddy program has taught me to successful drafting of a proposal, and also supported with literature review. And I have also learned advocacy skills, respectfully advocating for humanitarian rights in process. When there were setbacks, I have to follow up with patience and with resilience. When things got delayed, I have to wait patiently and never giving up until I got what I wanted. And also sharing of ideas with professional colleagues from Australia and PNG as well. I shared this experience with the recent buddy group, the 2025 buddy group, and it has really helped them so they can better know how best they could finish their project within the given time frame. How the buddy program has helped me develop leadership skills. I am now better able to contribute ideas and suggestions confidently in the clinical meetings, management meetings, and confidence in advocating for resources to support maternity services at a higher level with my bosses. And thinking big and beyond the horizon, this program has motivated me to continue the research which I have started, and I'm also looking forward to doing PhD one day if all goes well as planned for me. Beyond the shores of Papua New Guinea, as a PNG Midwifery Buddy, I had the opportunity to travel to Australia in September 2024 for the Australian College of Midwives National Conference in Melbourne. And I was also given free registration at the conference. And Linda and I had a lot of fun traveling around together, attending the conference together, as well as stopping in Sydney for a few days before traveling back to Papua New Guinea. Over to you, Linda.
Thanks, Rachael. Yeah, we have had an incredible 12 months getting to know each other and to be a part of this buddy program. We were both, I think, feeling very lucky that we were chosen to be part of this. I think for me, I really learnt more about what it means to be a leader. I work in a leadership role, but I think this really gave me new challenges and how I would share those leadership skills rather than just use those leadership skills. I was able to learn a lot from both the colleagues from Australia and PNG while I was in that group as well. We had an amazing group of 21 midwives as well as the leaders who were taking us along the journey. I learnt a lot about the things that I have taken for granted as a midwife for my whole career, and not realizing that there were so many other people in the world who didn't have access to things that for me were always at my fingertips. And particularly when I think of how close our neighbours are in PNG to Australia and how different the experience is for midwives there. The midwives in PNG are absolutely incredible. They are able to do amazing things that in Australia only doctors do. They are so woman-centred and so passionate about protecting women and looking after the women and their babies. They have a lot of skills, a lot of knowledge and a lot of resilience. and they're very strong as a team because they really work well together as midwives. And today in Port Moresby, I know Rachael was out with many of her colleagues campaigning for better working conditions, better conditions for women having babies. And I saw a lovely video of Rachael on a microphone proclaiming that as well. Being a buddy has really reinforced for me what it means to be a midwife. We have the same values, the same visions, the same passions, and we're all thinking about women and babies that we're caring for. It doesn't matter where you are in the world. When we're a midwife, it really means something very special and very different. And I'm very proud to be able to stand alongside my PNG colleagues and friends, particularly Rachael and Elizabeth, who were my two buddies in PNG. We really learnt to work together as a team, and we got a lot of things done. Some of the things may look small and it's small steps, but everything is about improving those outcomes for women and babies in PNG. And then this wasn't possible for, for us. So, Rachael and Elizabeth and I and the other buddies, we volunteered our time to be a part of this program. But there's, as in running the VIDM, there's a lot of costs involved. And we really want to thank Rotary for supporting this project, for seeing the possibilities and funding that vision that was there, and to have kept it going for 5 groups to be able to go through as well. I want to thank Professor Helen Hall and Judith Brown for leading and growing the Buddy program in Australia, for getting the ideas going with other people within the Australian College of Midwives as well. And then to Mary Satang, Paula Zabadi and Dr. Julie Kep for their leadership and action in PNG. They're the ones that will keep this going. So while the Buddy program is finishing in at the end of this 2025 group, they are continuing it along, and it's like a dominoes effect. So midwifery leaders in PNG will continue to support new and upcoming midwifery leaders. And Rachael has already done a lot of that. She's helped people within our year of 2024, the people in 2025, and also the people in her workplace. So she's really, her leadership skills, she has been very quick to then share those leadership skills onto somebody else, which is fantastic. We also want to thank the PNG Midwifery Society and the Australian College of Midwives, who have kept us supported and made sure we were able to be there. And to all the PNG and Aussie buddies that we have made connections with and made commitments to improve the lives of women and babies, both in our group, who are very special to us, but also in the other groups as well. We've been very fortunate. I'll stop sharing, Ali. And that's from Rachael and I. Thank you for listening, and I hope you've enjoyed learning about our program.
Thank you so much, Linda and Rachael. I think, like the VIDM, buddy projects for me are one of the things that keeps me inspired as a midwife. I think we heard in an earlier session that sometimes as a midwife in your own setting, in your own country, you can sometimes feel quite isolated and a little bit blinkered as to the way that you work, and buddy programs really help you to open your perspectives, open your horizons, meet new people, share ideas. And the little experience I have of buddy programs is that there's always mutual benefit actually in these projects. So thank you very much for all of that information and sharing. There hasn't been any questions in the chat yet, but I think that's because everybody was mesmerized by your explaining and your story. So please feel free now to answer, put any questions in the chat if you would like, or you can raise your hand as well if you would like to verbally ask a question. And maybe while those questions are coming, do you know of any of the other projects that happened within this buddy program? I know that antenatal work is really important in some countries, as often this is where maternity is lacking. and hemoglobin for women is really important to be monitored. So this is an important project. But what were some of the other things that the buddies did as part of the project?
Yeah, I think there was quite a big range of ours. Some were small, some were very big. There is a lot of women having babies in Papua New Guinea, but there are not a lot of midwives. In fact, they don't have anywhere near enough midwives, as with everywhere in the world. So trying to get women to have supervised births was seen by a number of people. So Elizabeth in Bougainville, that was really part of her project, was to try and get more women to have care. There were some of the others did incentive type bundles as well. There was trying to improve antenatal care, getting people seen through pregnancy. There were a couple of male midwives in our group, and one of them has done some fantastic work with sharing resources about doing antenatal care. And a little side point to his project was that he was often out in a boat going to very remote villages, and they didn't have life jackets. So they were also able to purchase life jackets so that the staff were safe while they were going out to visit these remote villages. So that was just something extra. Somebody wanted a fridge to be able to provide food for women in labour. What were some of the other ones, Rachael, in our group? You're on mute as well.
The other body chose a maternity waiting home due to a lot of women having BBA, birth before arrival. So she decided to build a maternity waiting home just near the health center so that women can come and wait there when they are due and not in labor, but they just wait around, and when their time for delivery comes, it's easy for them to access the health facility just close by and deliver their babies.
These are all really interesting and useful things. And sometimes they can just be simple things. And the safety of the staff is just as important as the care for the women as well, I think. Like the life jackets. How many times have they gone on that boat and not had that protection as staff members? And that's a very simple change that will improve their work. So we have a comment from Michael. Thank you for sharing your inspiring story of working together. Miranda loves this and thanks you for sharing. Kerry Ann says, thank you so much and brilliant project and outcome. Was it possible to collect any midwifery observations and statistics before and after the introduction of hemoglobin testing in relation to the incidence of postpartum hemorrhage?
I think that's part of Rachael's next big body of work. So Rachael has not stopped with her data collection, have you? It's all done on paper. So this, there's a lot of going through antenatal record books rather than a computer screen. But this is something that Rachael's very interested in keeping to see what the outcomes are, not just about the physical stuff, but also the experience for women if they've had a better experience of birth as well. Do you want to talk more to that, Rachael?
I'm continuing to collect the data of women coming in for their antenatal care at the facility I'm working in, and also we'll continue to collect until probably end of this year, and I will compare with last year's data. So by then we can make a good story out of it.
Yeah, it's probably a little bit early. It's only been a couple of months, so it's a bit hard yet to see the full outcomes of how this has changed things. Yeah.
Thank you. Good luck in that future work as well, especially the laborious nature of trawling through all the data. Tara says, such amazing work. Mentorship is so important in midwifery, and there's so much research out there, isn't there, for midwives leaving the profession because they haven't had that mentorship support. So hopefully with these buddy programs, it does incentivize people to keep on going, and that they're in this huge arena of people across the world fighting the same fight and supporting each other. Michael, is he part of your project as well? He's mentioned some of the projects
I wonder
there
if
about
he might be part of the 2025 group, I think. Other projects this year. Well,
family planning.
yeah.
Sounds good. And Marcus says, loving the energy, how would you rate digital versus physical presence in the process? I think that's about the buddy system. How much of your interactions were digitally, and
Yeah.
how much did you actually get to support in person?
Yeah, and it has been, that's one of the challenges, I think, because we deal with, if there's a storm in Port Moresby, often we lost the internet, sometimes halfway through talking. So we have done a lot of communicating online using WhatsApp and Zoom and emails and messaging. So we've done most of that. It was very fortunate, I think, for Rachael to have the opportunity to come to Australia. So that isn't a common thing. So that was very lucky for us to be able to do that, because we got to brainstorm so many more things while we were in person and not influenced by connectivity. I think the physical getting together certainly makes a difference. And that week that we spent together in April 24, it really felt like we've been together for a month, not in a negative way, but it felt like we got to know each other so well in that time.
Yeah. Red's saying it's an inspiring idea and it would be amazing to expand this worldwide. And there are other buddy programs, but they're probably underutilized, I think, across the world. We could definitely use more of this going on.
And we hope that these kind of things like Rachael and I presenting tonight is hopefully will inspire other people to be thinking about this, because they really do make a big difference.
Yeah, definitely.
Yep.
I'm just going to go back to sharing my screen. But if there are any other questions, please continue to pop those in the chat. And Michael's saying that they're hoping to take the buddy program to other countries. That would be amazing as well. Thank you. And Miranda's keen to get involved. So you'll have to look out, I guess, in your own institutions or workplaces, or maybe you could be the person that instigates a buddy program, from links maybe with people you've met during this conference. I'm sure everyone is quite happy to pass on details and link up if you're interested in doing something like this.